Good morning, everyone, and welcome to our July Security Health Plan Academy webinar. As many of you already know, this series was created with our members in mind. Each month, we aim to share information that's relevant to your health, wellness, and healthcare plan. And today's topic is no exception. This month, we're focusing on falls in Wisconsin and the impact they can have as we age. We'll cover practical steps you can take to improve your balance and reduce your risk of experiencing a serious and potentially costly fall. We're excited to welcome another expert speaker today, Jennifer Clark, a community health educator with the Aging and Disability Resource Center of Central Wisconsin. Jennifer has been with the ADRC for 12 years. She holds a master's degree in human and community resources and a bachelor's degree in health promotion and wellness from the University of Wisconsin-Stevens Point. Her work focuses on fall prevention initiatives, including partnerships with local organizations and coalitions. She's the perfect fit for today's topic, and we're fortunate to have her here with us. So without further ado, Jennifer, let's go ahead and dive in.
Great. Thank you, Ashley. Good morning, everyone. Thanks for being here today. As Ashley mentioned, I'm Jennifer Clark. I'm a community health educator with the Aging and Disability Resource Center of Central Wisconsin. And while I'm not an expert in falls prevention, I have spent the last 12 years working with fall prevention in a variety of different ways, including some different fall prevention coalitions, some community programming, evidence-based programming, and then just some work with our local fire EMS departments. And then just spending time looking at some of the research and learning more about best practices. So I'm really excited to be here with you today. See if I can switch my slide here. So just a quick overview of some of the things that we will cover today is just kind of looking at falls in Wisconsin in general. What's the big deal? Some of the statistics around falls. Why is Wisconsin ranked #1 for fall-related deaths? Who is at risk and what are some of those consequences of falling? And then some steps that you can take to reduce your risk, and then some just fall prevention resources that I wanted to share. So starting off with falls and some of the statistics. So what's the big deal with falls? Data shows us that falls are happening frequently. They are expensive and they really do have some enormous health and community impacts. So I just tossed out a couple statistics here just to kind of give you some highlights. We know that in the United States, over 14 million, or 1 in 4 adults age 65 or older fall each year. And there are about 3 million emergency department visits due to older adult falls. So you can see these are some pretty big numbers. So if we get a little closer to home, falls in Wisconsin, according to the CDC, Wisconsin has the highest fall death rate among older adults in the United States. So this is obviously not a statistic that we are super proud of. If we look at where falls are happening, it's mostly, you can see that first in private residences. So things like your homes or your apartment complexes. Nursing homes are the second on the list there, are also a common location, which could just be attributed to the population that they're serving. When we think of private residences and some of the top locations for falls, I'm sure a few probably stand out to you, or you can think of some locations within the home where falls most occur. Typically our bedrooms, living rooms, bathroom areas are the most common. I did ask this question of some of our local EMS and fire personnel about what they see as top contributors in the home. And they'll usually tell me things like throw rugs, clutter, and even just a lack of strength or inability to even get out of a chair tend to be some of the top reasons they see too in the home. So there's really no doubt that falls are a huge issue in the United States. But right here in Wisconsin and likely within your own communities as well. So why is Wisconsin ranked #1 for fall-related deaths? I get asked this question a lot in a lot of presentations in programs all the time. Many tend to assume that Wisconsin's high death rate is due to the state's colder climates, which is a really good guess. However, when we look at states kind of neighboring us, um, for instance, they do have similar climates, but if we look at their rate of falls, they tend to be a lot lower. The truth is we really don't know why, but it's likely due to a combination of different factors. While the winter weather obviously does play a role as we kind of battle that snow and ice each year, it's really not the only contributing factor. Some things like lack of physical activity, especially in our winter months, do contribute. I actually had a physical therapist recently tell me that springtime is always her busiest time of year. She tends to see a lot of people who are maybe sedentary over the winter months. And as soon as the weather starts changing and it gets nicer out, people want to be outside and they want to go into their old summer routines and habits. And that's where we see that injury prevention typically. So our muscles tend to get weaker over that time, and we're more prone to things like falling. Alcohol use also plays a role. So I know I'm not telling you anything that is maybe new, but Wisconsin has a high rate of alcohol consumption. So as we get older, our bodies actually respond to and process alcohol differently than when we were younger. And so often we see that the side effects, people are more sensitive to its side effects, which can contribute to their balance. Chronic conditions can play a role. Wisconsin has a high prevalence of chronic conditions, so we know that when people are being treated for a chronic condition, they're often on taking multiple medications to treat that condition, which can have side effects. So therefore, putting people at an increased risk. Um, More adults are aging in place, so we're staying in our homes longer, which is great. Therefore, also increasing our risk of falls just due to age-related changes in our home environment factors and even our health conditions, again, playing a role. Social isolation can be another reason. We don't often think of social isolation as a risk factor, but it can be. When we think of social isolation, we aren't getting out and about. Maybe we've experienced some muscle loss due to reduced mobility. Maybe it's depression or anxiety, reducing our motivation to stay active and engaging in those activities. And then just reporting practices I included on here as well. We know that falls could potentially be underreported, or I'm sorry, we could report falls in Wisconsin could look the way we report falls could look differently in other states. So those are just a few contributing factors. So who is at risk? Really anyone of any age can experience a fall, but there are certain groups that are higher risk. So, older adults, 65 plus, people with medical conditions or chronic illness, individuals on certain medications, those maybe living with a vision or hearing loss, people with poor mobility or muscle weakness, those who have maybe had a history of falls, and then people living in unsafe environments. So we'll dive into these a little bit more, these risk factors in a moment, and what we can do about them. So the good news is there are steps that you can take to reduce your risk. So again, we'll walk through these in a little bit more detail here. So starting with exercise, exercise is by far the most important aspect of fall prevention. So some things that we know is that the most common reason for falls is age-related muscle weakness. Our strength actually begins to decrease after the age of 30 and decreases more rapidly after the age of 70. So when I was doing research, that was a little disappointing to me to hear that already at age 30, you start to decrease that muscle mass. Um, the good news is that strength and balance can be improved at any age, but it does take some work. And so we do have to make sure that we're doing things, strength and balance exercises, and putting in the time and effort into those. So here's what we can do. Um, is work directly with a physical therapist. So physical therapists have that ability to provide some targeted exercises that are unique to each individual. So setting up a time to really connect with that physical therapist so they can look at your individual goals and where you are currently, and give you some ideas and tips on what you can do to increase that strength. And then, if possible, engage in community or home-based exercise programs that keep things challenging. And I think that's kind of the biggest part here is that if you're going to do those exercises, always reflecting and asking yourself, um, am I keeping this challenging enough? Um, so we'll talk a little bit later in the presentation about some different community and home-based stuff that you can do, and what I typically will recommend to people. Having a medication review or reconciliation can reduce your risk as well. So here's what we kind of know about medications. Just being on 4 or more medications ultimately puts somebody at an increased risk for falls. And that can be over-the-counter medications or it can be prescribed medications. You really have to take both into consideration. We know that some of the more risky medications include things like sleeping pills or anxiety or depression medications, blood pressure medications, anything that really causes those side effects, such as dizziness or lightheadedness, drowsiness, can all put people at risk. So maybe they don't fall within one of those, but if you're those types of medications, but if you're experiencing those types of side effects, that would be a red flag, and maybe having that conversation with your doctor. We also know that as the body ages, the liver and kidneys don't break down drugs quite as well. So ultimately, you will get like a higher level of that drug in the bloodstream and can ultimately have, increase your risk for side effects as well. So what can we do is just really making sure that we're getting those regular medication reviews. You can do that with a pharmacist. You can do that with your doctor. Um, they're often covered by Medicare Part D. People don't realize that their pharmacists can schedule those as well. And oftentimes, I feel like our pharmacists are underutilized resources. They know a lot, and are happy to sit down with you, make that appointment to kind of go through your medications. Um, Making sure that we're using pill boxes for a few different reasons to make sure that we're ensuring proper dosing, that we're taking the correct doses, but also in helping us to remember to take medication. So you can kind of look in your pill box. Did I take those today? Yep. So the pill boxes can be really helpful. And then keeping an updated med list. I find that people tend to rely solely on the medication list that is printed off of the printed from the clinic or given to them by their doctors before an appointment. However, what I find is that if people are doctoring between multiple health systems, and maybe they're being prescribed one medication at this system and another medication at that system, their systems don't always talk. And so if you're not keeping those updated, our doctors don't always know either. So, keeping, if you like to type out medications, you can certainly type them out. There's different apps on your phones you can use, but I just highly recommend always keeping that med list on you and reflecting and making sure that it's up to date. And then talking with our doctors and our pharmacists regarding any side effects. I think a lot of times people kind of accept the medication side effects because they believe they don't really have any other options, or my doctor said I should take this, so this is just kind of the way it makes me feel. When it could be just a quick change in a medication that treats the condition, but doesn't give you the added side effects. So again, having those conversations with your doctor are so important. And then just getting regular vision and hearing checks can help us reduce our risk as well. So what we know is that there are some common eye conditions that can put people at risk for falls. You may know someone that has experienced one or more of these, but they tend to be glaucoma, Cataracts, macular degeneration, or even diabetic retinopathy are some of the ones that we tend to hear. Um, the progressive or bifocal lenses can also put us at an increased risk. These types of lenses often will impair our depth perception. So I just think of like going over sidewalks or curbs. Even steps and stairs can be hard to navigate if you have a progressive or bifocal lens. And then we also know that hearing impacts balance as well. So what can be done is just making sure that we're getting those yearly examinations or as recommended by your provider. Using assistive devices when needed can reduce our fall risk as well. So just knowing and understanding when it is time to consider using a device. What we know is that a lot of people tend to use assistive devices without proper training. So this is where we'll often see people using the cane in the wrong hand, or maybe the cane or the walker isn't adjusted at the correct height. So you'll sometimes see people kind of slouched over walkers or canes because they're not adjusted properly. Um, Another thing we know too is that a lot of people don't use assistive devices because they're reluctant to start using them. Maybe they're embarrassed or they feel like they're losing their independence. I've noticed that this can also apply to grab bar installation in the bathroom. I've had several people just tell me, oh, I don't really like the look of that. So they're a little more reluctant to use that because they're just afraid of what others might think or concerned about how it looks. So what can be done is just knowing and understanding that using assistive devices is far better than experiencing a fall. We know that there's many impacts to falls, and if these can be prevented by using a cane or a walker, that might be the best option. And then if you do start using a cane or a walker, make sure that you do receive that proper training. I know PTs will often do assessments to help you adjust those devices correctly so that we're using them correctly and they're comfortable to use. And then lastly, just keeping our home environment safe can prevent falls. So I know we discussed a lot of this already, but most falls happen in the home. But there are some easy things that can be done that don't require a lot of time or money. And it might be just something simple like picking up a throw rug or maybe rearranging your living room so that the furniture isn't a hazard, or moving things in your kitchen that you use frequently down to a lower level so that you're not having to get up on a step stool, or heaven forbid you climb up on your countertop, your kitchen countertops to get something, but bringing that stuff down to a lower level so it's easy to grab and reach. So just some simple things. So what can be done? Some of that, and then often I will recommend that people take a peek at the Check for Safety brochure, um, which is provided through the CDC. I will actually include this um, in an email form with a link attached so that you can access this if you need to. It'll be sent after the call today. But this brochure kind of helps people walk through some of those home hazards that they might consider changing or modifying to make their environments a little bit safer. So I just wanted to spend the last few minutes here just kind of pointing out some different fall prevention resources that are available. The first thing that I wanted to point out to you, and again, as we go through these, there'll be a lot of links and QR codes that I will share, but there will be an email after today's presentation that I will make sure that we include all of these links in there that you can access as well. So again, I wanted to just point out the Fall Free Wisconsin website. If you've never had an opportunity to visit this site, I would really encourage you to jump on there. It's a relatively new site, and it was developed within the last few years or so. Some highlights on this site include just an interactive home safety challenge. Since most falls do happen in the home, uh, this challenge is just an opportunity for you to kind of tour a real Wisconsin home and search some common things that might lead to a fall. And then it provides some tips on things that you can do to reduce your risk. On this website as well is a falls free checkup. And this is where you can learn about maybe some of what your risk factors are for falls and then also test your knowledge as it relates to falls. There's some fall prevention programming on that website as well for your area. So we'll talk a little bit more about some fall prevention programs in just a moment. And then also I put some fall prevention tips and information. There's a lot of information on that website too, um, as well as exercises and even some information for family caregivers and falls. So again, check this out if you haven't had an opportunity. I did include the QR code here, but again, the link will be posted in after the call today. So one of the programs that I just wanted to spend a little bit of time talking about is the Stepping On program. Stepping On, if you've never heard of it, is a 7-week evidence-based fall prevention program. It does meet one time a week for 7 weeks. Each session is about 2 hours long. And we do offer these um, in a variety of different settings throughout the community. So I know we've offered them at the EDRC, we've offered them in churches, fire departments, libraries. Um, I think one of the best parts about Stepping On is that participants get to work directly with community experts on a variety of different topics. So I kind of listed them out here. Physical therapists, the participants work with that PT 3 different times. You're provided with a booklet of information on some different strength and balance exercises that we make sure um, that you walk away doing them safely and or modifying them if needed. So the PT is such a great resource. They also talk about getting up from a fall. We do some navigating of curbs, sidewalks, outdoor terrain, that kind of thing. Um, Another expert we bring in is our optometrist and our pharmacist. So they're talking more about the eye-related conditions as we age, and then some of those medications that put us at an increased risk for falls. And then we do bring in a member of the fire department or police department as well in these programs, and they're really there to kind of talk about community safety. What sort of things do they see out in the community as risk factors, and how what happens if I do experience a fall and have to call 911? What does that look like? So these classes are typically either free or some may have a very small fee. It really just depends on the county that you're participating in. I know ours through the ADRC of Central Wisconsin are typically free. We have a suggested contribution of $10 for the entire 7 weeks. But we just kind of put out a contribution box. So again, just checking with your local ADRC or even the Wisconsin Institute for Healthy Aging to see what's available in your area. So this is just a picture I tossed in there of a class that we had last fall in our Mosinee area. So you can just kind of see it's a smaller, more intimate group of people, usually anywhere between 12 and 20 people. But it's a lot of fun. They're very interactive. We're getting you up and out of your chair quite a bit. And then like I said, going outside and navigating some different things too. So very interactive. It's probably one of my favorite programs to lead. So I did just post some of our upcoming Stepping On programs this fall within our ADRC of Central Wisconsin region. So we cover Lincoln, Langlade, Marathon, and Wood counties. So we do have some programs coming up in Stratford, Wisconsin Rapids, Wausau, and Marshfield. But again, there are programs available throughout the state of Wisconsin. So there is a link at the bottom of the slide and a QR code where you can find classes in your area. And again, it'll be listed in that email as well. I won't spend a lot of time on this slide because it sounds like there were some maybe previous webinars that included more information on OnePass fitness programs, but I wanted to encourage you to check this out if you haven't already. So one pass is just kind of a fun way to exercise and socialize with others in the community. Um, you can also receive access to digital fitness content or on-demand and live streaming fitness classes. So if you have an interest in this or more questions, you can certainly visit the website or contact Security Health Plan as well. And then these are just a few other resources that I'll often direct people to. Senior Planet from AARP has a lot of great online classes available. Everything from exercise classes, could be like a stretching or meditation, balance and strength, all the way to technology classes. They just have a lot of options on their website. So always encourage people to check out the Senior Planet from AARP. It just has a lot of really good things on there. Silver Sneakers for YouTube channel has a lot of great exercise classes too. What's nice about this is that you can pop them up at any time. And there's just a lot on there. It's free of charge. So something to keep in mind as well if you're looking at doing something from home. And then I also wanted to point out UW Extension offers a Strong Bodies virtual class. Strong Bodies is an evidence-based strength training program, which is really designed to improve strength or muscle mass, bone density. Um, all of the exercises are done from a seated or standing position. Um, and those are frequently going on throughout the year. Again, they're virtual, so you can do them right from the comfort of your own home. And there's not a lot of equipment that's needed for them. I think they use some hand weights, maybe some ankle weights. But other than that, if you have a nice sturdy chair and some weights, that's all you really need for that program. So again, these links will all be included in the email that goes out after the call today.